5 minutes to make remarks during the general comment period, and 1 minute following each consideration of action items. Members of the public must be respectful of individuals making citizen comments before, during, and after such comments are made. Profane, insulting, or threatening language, including any racial, ethnic, or gender slurs, will not be tolerated. Any refusal to abide by these rules or interruption of this meeting may result in cancellation of the speaker's remaining time, removal from the meeting room, or a charge for disruption of the public meeting.
Thank you very much. I now call this meeting to order of the Floresville City Council regular meeting, June 14, 2018 at 6 p.m. Please rise for our invocation with Mr. Fred Gonzalez, followed by our pledge of allegiance and Texas pledge.
Let us pray. Heavenly Father, once again, we ask you to be with us as we conduct the city's business. First and foremost, we thank you for your many blessings. We also thank you for those people who give of their time and talents freely. We ask that you guide us all, but particularly our leaders, in doing the best job that we can for our city. Give us all the wisdom to know what's best for our citizens. Help us to always be mindful that everything we do here is for their benefit. We pray this in Jesus' name. Amen.
I'll open the floor to any citizen comments. This is the opportunity for citizens of Floresville or this area. Monica, they can't hear. Okay. Once again, I will open the floor to any citizens comments. If you would state your name, and you will be allowed 5 minutes. Thank you.
Good evening, Council. Henrietta, Joanne Johans, and Henrietta, I'm so glad to see you here. By the postings on Facebook and by everything that signage, I would have thought you were long gone. Glad to see you're here.
Glad to be here.
I'd like to relay a quick story. When I was in my 20s, I went to work for a bank, and they said, you can have the job as a teller if you'll go to this one branch. I said, okay. I had no idea of the location, wasn't familiar with it. Well, on my first day there, I found out that it was 98% black. There were hookers on the corner, and it was right across the street from the Black Panthers. I learned a very, very valuable lesson about how valued that bank was to that community. And the Black Panthers actually protected us. So I learned a very valuable lesson. And I'm hoping that everyone can learn a valuable lesson and realize that you, all of you, every single one of you, are here to protect and guide this community. You're not here about your personal agenda. You're not here about your personal alliance. And I know every single one of you sitting here, everyone, you all have a certain alliance to someone or something. Your alliance needs to be with the city of Floresville, period. And I hope that you can keep that in your heart. Thank you.
Thank you. Any other citizens' comments this evening? Yes, sir. No? Okay. All right. If no other citizens' comments, moving on to item 1, our public hearing to consider a request to rezone 1.3 acres from existing R1 to propose commercial to be appropriated for a business at 100 Wilson Drive here in Floresville. It's 6:05.
Council in there, what you have in your package, this has to do with voluntary annexation of the property that's located on 181, also known as 10th Street, over there by the Coys. And it is going through the voluntary annexation period. And as you know, when that property is annexed into the city, we have to consider the zoning. At your last meeting, you considered actually taking jurisdiction of this permitting. It is right now in the county coming to the city. And so it did appear last week at a PNC. It had a public hearing as well. There were no comments. There were no issues. But we will open up the floor if anybody wants to comment. But it is coming into the city, hopefully, as R1 will be the zoning. And they're asking it to be changed to business, for business purposes. And as you see, the 181 Wilson Drive. In your packet, that has to do with item H and I. Do you have any questions of myself or staff? Otherwise, Mayor, I'll let you public comments in the floor.
Okay.
Yes. If you will move your microphone closer.
Has anyone tried to oppose anything?
No, we had a public hearing, and it has gone through PNC, and there were no oppositions. I've had a lot of questions as to what's going there. It is a well that is actually located there. There we have a city sewer and Oak Hills water. That's just the way it's set up. But no, we only had questions as to what's going there. They're relocated from their existing location further down. But to have connection to our sewer, we were requesting that they be part of the city, and this is part of the voluntary annexation program.
Any other questions by the council? If not, I will allow any citizens' comments pertaining to this issue. Okay. If not, the public hearing is now concluded at 6:07. Thank you very much. Well, again, we'll be going on to that item later on in the agenda. Okay, moving on to old business, consideration and action to approve minute meetings for the regular council meeting of May the 24th, 2018. Council, you've had your packets for a couple of days. We have the minutes in there. Does anybody have any comments, questions, or suggestions on changes?
I'll make a motion to approve.
Okay, I have a motion on the floor by Councilman Jimenez, seconded by Councilwoman Cantu. All those in favor, please raise your right hand. Thank you. 5-0. Moving on to item 2B, consideration action to approve the minute meetings for the special council meeting on May the 29th, 2018.
I'll make a motion to approve.
No questions by the council? I have a motion on the floor by Councilman Jimenez, seconded by Councilwoman Cantu. All those in favor, please raise your right hand. 5-0. Thank you. Okay, moving on to item 3A, the Atascosa Health Center presentation. We have Mr. Monty Small.
Council, I do have some handouts. If it's okay to take over together the handouts. Is it okay if you give me the handouts?
Yes, that'd be fine.
Do you want to?
If you could, yeah, talk a little bit louder or talk into the microphone, that will help.
This takes a few seconds. I'll check it out earlier, making sure it works. And I know we have a lot of time, so. Anyway, let me introduce myself. I'm Monty Simone, the CEO of Atascosa Health Center, and we also operate the Wilson Community Health Center. And we're here to address the council and citizens. I give you a little bit about what we do and why we're here. And we've been here since 2007, and we've been the best kept secret that there is within there. We have 2 board members that are from, can everybody hear me okay? Yes. How about now? Yes. Good. I want to make sure. We have 2 board members that are from Wilson County, Ms. Luana Newman Lewis and Carlos Munoz. They represent Wilson County on our board, and I'll tell you more about our whole program in a minute. Christina Rodriguez, she's not with us here today. She's our practice manager. Maria Tenorio, she's the one just handed out the flyers and stuff within there. She's our HR specialist. Sherry Frank is our director of corporate compliance. She'll be speaking briefly. And also Maria Garcia, our chief financial officer. This is the mission. I'm not going to read it and save the time, just to say that within there because you have it in your handouts what our mission and what our vision is and what we're here for. And as you can see, we cover 5 counties within there. Within that. We'll move along quickly because I know you have a long agenda and I don't want to keep you very long. Just give you, we have 6 sites. We started in Pleasanton. We have a site in Carnes and Wilson. We opened up both of these sites in December of 2007 within there. Lightwell Community Health Center in 3 Rivers, McMullen Community Health Center in Tilden, and Lyden Community Health Center in Lyden. And we're looking at opening up a 7th site in Poteet. This is our service area map. Kind of gives you where we're at in the 5 counties within there. Everybody's familiar with that. A little bit about AAC, but what the world is Atascosa Health Center within there. Well, we were founded in 1978 as a rural health initiative. We were located in Atascosa County. This is where we started at. Moved to Pleasanton in '82. We're a 330 grant. What that means, we get federal funds to do what we do. And we're going to talk about that. One is like the sliding scale fee. You come into our facility and you need health care, behavioral health care, and dental, we're going to take care of you. If you can't afford it, we're there for you. We'll slide that down. And Maria will talk a little bit more about the slide on her presentation within there. We're a federally qualified health center. We have 5 core mandates. We have a volunteer board. We just talked about the 2 board members from here. We also are located in a medically underserved area, in a medically underserved population, and that's where we're at within there. Going on, we have we're a 501c3 not-for-profit organization within there. We offer comprehensive primary health care services and other services to facilitate access to care. And Sherry will really go a little bit more in depth to that because I want to spend a lot of time on there. We have an established way to test patients' financial means. And again, Maria will talk about the sliding scale fee within there. Who's our providers within there? Our medical provider, our dental provider is Dr. Irish. She's our dental director for the whole system, and she's also our dental dentist here in Floresville within there. Dr. Salazar is our family practice physician. We have Dr. Nair, so OB-GYN. We have Dr. Thompson, she's pediatrician. And that is something to really have in the community, is have a pediatrician with there. And so we're very fortunate to have her with us. We have Erin Hoffman, a family nurse practitioner. And then we have Pamela Clark, who is also a family nurse practitioner within there. Services provided, and I'm going to turn this over to Sherry. See how good she is? She knew right what to be.
Thank you. I hope you can you hear me okay?
Yes.
So I won't read off everything on the list, but the basic, or the most important thing is we offer medical and dental services to anyone who walks in our facilities. Maria will address method of payment. We will see anyone for any of these needs in dentistry, children and adults. And the nice thing about Dr. Thompson is that child can go see her for a Texas Health Step or an acute illness visit. So your kids can come see us and we'll take care of all their needs. We're a 340B pharmacy, and I'll go into a little more detail later on how that benefits in terms of dollars to our prescription program. Behavioral health is really important. Our community really can benefit from the services that we have in our facility through Camino Real. And we also have in our facility here outreach, screening, assessment, referral services for patients who need contacts and resources for alcohol and substance abuse. One really unique thing that we offer is that we can tap into state-funded programs. We have a couple of programs that I'm highlighting here for you that services females and males. Our Healthy Texas Women and our primary health care plans are state-funded, and they are providing primary care benefit services for our patients, screenings, preventative visits, cholesterol, diabetes, hypertension, high blood pressure. We will put you on one of those programs. Based on income, you can tap into the state-funded programs. We have in this clinic here in Wilson County, 460 patients are using this resource. This, by the way, is 2017 data, so I'm going to the full year on that. The other nice thing about our system is we're unique in that we forge relationships with people like American Cancer Society. We obtain grant funding and we build relationships with American Cancer Society and MD Anderson. For one example is we provide colorectal cancer screening. Preventative for the patient, no charge to them. We have 669 patients on that program. They receive that service at no cost. American Cancer has been a great friend to us. They've also now awarded us, I should say, a grant to promote education on HPV vaccinations. And that's great for Dr. Thompson because she sees our pediatric population. So that's targeted for kids 11 to 13. And that is the targeted age range for them to receive that vaccine. So we have education services that will help promote that as a cancer prevention method. Additionally, we have also built a relationship with CPRIT, which is the Cancer Prevention Research Institute of Texas. And together with UT Health Science Center, we were able to deliver screening for hepatitis C. We have done remarkable work here in this county. We have taken 79 patients to the screening process. We've taken 8 of those patients to curative treatment. One, we're actually now up to 2 have successfully completed that program. They're cured of hepatitis C. That is a $32,000 retail pharmacy prescription. It's an optional $8 fee to the patient. So that is a tremendous benefit that we offer our clients here. And another relationship we built is with Methodist Healthcare Ministries. With the Methodist Healthcare Ministries, we're able to provide preventative care for our patients who have 2 or more of either hypertension, high blood pressure, diabetes, depression, obesity, and we have 36 patients on this program this year. We're going to keep our enrollment open through the end of the month, so that number will go up. And it's really nice to be able to do that. I grew up in this town, so in an indirect way, it's a blessing to be able to provide these services to my family, my friends. This is where I grew up, and this is where I live today. I'll pass this over to Maria, and she'll talk to you a little more about the insurance.
Thank you very much. And good evening, everyone. Council, Marietta. Actually, it's not really types of insurance, it's our payer sources and how we generate program income. Aside from being a federally funded health center where we get a federal award, the federal award offers us a sliding scale fee discount program that we offer to our uninsured and underinsured patients. As an example of how the program works, there's 2 criteria. We need your household income and the number of members in your household. If you qualify for 100%, that means that if you come into our clinic and you're new to our clinic and the provider requests all kinds of items along with the office visit, and it generates a total charge of $400. If you qualify for 100%, those $400 just get written down, and all we ask of you is to pay a $30 nominal fee. We ask of that, but if you don't have it, we will not deny you service for the inability to pay. What we'll do is we'll bill you for it, and after X amount of times to try to collect, then one of the things that's nice about receiving the 330 federal award from HRSA is we get to adjust it. But after we attempt to try to collect from you. Aside from offering a sliding scale discount program, we also accept Veterans Choice for our men and women who serve our armed forces. Then we also participate with Medicare, Medicaid, and third-party insurances. Today we are trying to work with various amounts of insurances, up to 300 different types of insurances for all 5 counties that we serve. Now this next slide represents the payer mix. For every patient that walks through our doors, we classify them into 5 groups. Under self-pay, Medicaid, Medicare, special programs, that's what Sherry mentioned earlier in her presentation, with the primary health care, and also the health and teaching program that we get with the state, and private insurance. As you can see, this training from 2015 to 2017, our total uninsured or underpaid patients that we saw before 2015 was 2,261, and we ended 2017 at 2,958. That's a 30% increase. We saw an extra 700 patients from 2015 to 2017. Now, one of the nice things about the payer mix, underneath the bottom half of the slide, is it shows you the percentage of how many patients we actually see. The average of the 2,264 patients we saw in 2015, 37% represented self-pay patients. That's the major type of patients that are walking through our doors. The next one is private insurance at 282, then it goes to Medicaid, and then special programs, and then going to Medicare. That's one area which we want to tap our revenue into to try to increase more patients who can see us that have Medicare as an insurance. And then finally, all this, we have an individualized operating annual budget for each of our sites. Here in Floresville, in 2015, the total expense to operate our Wilson Community Health Center was $908,000. In 2017, we increased operations, which is $1,283,000. So as you can see, at the bottom, it tells you how many employees we actually have employed at our facility. In 2015, we had 12 full-time employees. In 2017, we have 18. And if we are successful to get the construction of our new facility, we are forecasting that we'll be able to employ an additional 4 or even 8 more employees, depending on that we can increase our patient capacity. And now I'll turn it over to Monty.
And this will be the final, we put up real quick, because I know we're running out of time. Okay, this is just some of the challenges that we have. We really want to add new providers within there. This is some of the challenges. This is what the vision, this is why we're really here. Why are we here talking to the city council and stuff within there? Well, we want to do something. We want to grow, for one thing. We want to increase access. We believe that Wilson Community Health Center can be as large as Atascosa Health Center. At Atascosa Health Center, we have 7 medical providers. We have a staff of about 45 individuals within there. We can do the same thing here. That's the vision that we have. And through that vision, we've reached out to funders and stuff. We reached out to the Floresville Economic Development Corps, and I know they'll be talking to you about it a little bit later, to work on where can we put the building. Because one thing we look at is partners. Where can we get the funds from? Well, we reached out to the Baptist Healthcare Foundation, and we have a grant proposal in there that we're pretty sure we're going to get for $350,000 to help us build the facility. We also reached out to the Methodist Healthcare Ministry, who's also a good partner. And we'll hopefully to get from them about $550,000. And there's about $1 million towards the new building. It's going to cost about $2.3 million to build that facility. Why do we know that? We're building the same thing down in Karnes County that we've already worked within funding for that. We also reached out to the USDA. Within them, because they've been a good partner of ours. And we've asked them, will they make up the difference? And they said, yes, they will do that for us within there. So it creates a lot of work, but we're going to get it done. And the land that we're looking at is the Floresville Economic Development Corps, working with Tommy and the whole group within there. We are so optimistic. We'll be next to the Children's Bereavement Center, everything within there. And now we're here to the Floresville City Council within there. What are we looking for? We're just asking to, in the future, we'll be back and to help us to fund this. And it is anything that you can do to do that with it, be it waiving fees, if it's waiving permits or anything like that within there, could do that to help us build this facility. Because we are a not-for-profit 501c3. We try to pull everything together. We look at partners, because one thing that these partners that they ask us for, USDA, Baptist, and the Methodist, is what is the local community doing for you for this project? Yeah, we will invest, but what is the community doing? And when we can say, yes, they are very strong within. I mean, that's why we're here. We started here in 2006 working with the hospital. The hospital asked us, can you open up a community health center here? And we said, yes, we can do that. And we did. We opened it up in 2007. And through these years, we've been growing and growing and growing. And we've been kept a really good secret. You can see the numbers there and stuff. We don't do a lot of marketing, but we have the potential to really be your community health center and bring in the services, because we have a lot of partners out there that's giving us a lot of different funding revenue to help the patients, as what Sherry talked about on different diseases and so forth within there. And are there any questions? I know I talk fast. I did it on purpose, Mayor. I know.
Not a problem. Not a problem. If no comments by the council, I'll open the floor to any citizens' comments pertaining to the Atascosa Health Board.
Go on to the back.
Okay, yes, sir.
I've got a question.
If you'll come up to the microphone so we can hear you, we'd appreciate it.
I know that healthcare in this country is horrendously expensive. Now, I know the AMA deliberately caps the amount of doctors who can graduate from medical school to keep the demand for doctors high, so therefore we can continue to charge the outrageous amount of money that they charge for what little they do. Can you comment on that, sir. Thank you.
Probably my dad.
Can we get your name, sir? I didn't get that.
My name
Yes,
is
yes.
Paul. It's Paul. Yes, Paul.
Thank you,
Paul,
Paul.
what's your last name?
That's a very good question, because how do we get our providers and stuff? We have to stay competitive with the market within there. That's one of the challenges we have. Do we also, because being a federally qualified health center in a medically underserved area, we work with foreign physicians as well within there, with J1 visas, H1Bs as well, with that, to bring them into that, because you're right. The schools are not putting out enough providers. We also work with the schools. We work with UTF Science Center. We work with the school out in Corpus Christi to bring those doctors, those residents, into our health center so they can see and work and get to know what community-based health center is about. And the thing is that they want to stay there within there, and that's what happens within. It is happening. In fact, our medical director right now, Dr. Mitchell, who is in Carnes right now, that's the program he came through, was through coming from the Corpus Christi school through us as a resident and within there. But as it relates to the higher and higher cost of insurance, that's a tough one. I look at what the Affordable Care Act has done and everything else within there, and that is something I know Congress is working at, and we work at. We can't give you an answer saying we can lower that or anything like that. That's a nationwide challenge within there. But what we do look is within our sector, because of the unfunded, and we have our sliding scale fee up to 200% of the poverty guideline, we can reduce that down. Because even like Maria said, uninsured patients. What is an uninsured patient? Underinsured patient. An underinsured patient is, I have a deductible of $6,000 and I can't afford that deductible. Come into our center, and by law, we can help that, and we can waive some of those dollars for you and still take care of you in our health center within there. So I know I didn't answer your question completely, because that's a very, very tough and deep question to really delve into.
Thank you. Any other comments or questions by council or citizens? If not, thank you very much, and we look forward to the future item. Thank you. Thank you all very much.
Thank you all very much.
Okay, moving on to our next presentation. We have a presentation from Sean Spencer from Heartland on our park project.
Good evening, City Council and Mrs. Mayor and all the staff. Tonight I'm talking to you guys. You should have in your packet, which would be the budget and the site plan for the grant project, which is the second phase of the overall park project. This was the TPNW project that was awarded in 2017. It's the $1 million part, the part that basically addresses mostly the lower part, the existing part. The main features in that and lower were the splash pad renovation of the pavilions, food truck areas, playground upgrades, a new playground, picnic areas, connection sidewalks, basically everything to tie the two parks together. Worked with Ms. Turner and Ms. Monica. We all worked for a couple of months on this back then. We were working, getting ready for the grant. The idea of it was to make the old park new and connect it to the new park that's just about finished. That was kind of the big picture. We've talked about this park for quite a while. And it's a visionary idea. A lot of times when we work in parks, if you're building a park, even if it's near a new one, or a new one goes nearby an old one, the old one's left to rot, and the new one gets all the praise and all the traffic. So this kind of helps to tie things together. The budget is the same budget that was submitted to Parks and Wildlife. I think that's the budget that has to be submitted and be dealt with. Kind of a couple of things. I know there's been, over our time here, there's been a lot of discussions about...
Can I interrupt?
Yes.
Before we get on to this, when I asked about having a parks update, I wanted a parks update on what is currently back there.
Oh, sure, I can do that.
And
You
let's
want me
do
to-
that first.
Okay.
Because there are a lot of issues on that part of the park. And I had also asked that Hayes Engineering be here because they were the ones who signed off on the work that was back there. They couldn't make it.
Hayes Engineers not here. They should be here at the next city council meeting. They don't come and present to you until I'm at 100% complete. So they come and tell you, he's finished, we've looked, everything's done, it's finished. So hopefully at the next city council meeting,